Thank you very much. I want to begin by apologizing that we don't have an ASL interpreter available today, but we do have interpretation on video as well as full captioning, and we'll have it available by tomorrow for the press conference. I want to start just by taking a moment of silence for the victims of Sandy Hook Elementary School shooting in Newtown, Connecticut on the 8th anniversary of this tragedy. 25 people were killed that day, including 20 children, 6 school staff members. I just want to let the families know that you're in our thoughts and prayers. So if we have a moment of silence. The latest, thank you. The latest COVID-19 numbers. These are weekend numbers. We don't have any new numbers. We do have new numbers for Boston today, but we don't have new state numbers. 4,677 confirmed cases over the weekend. 41 new deaths were reported here in Boston today. 374 new cases, bringing our total cases to 33,323. We had 1 new death today, bringing our total to 953. And I just want, for the families that are sick and suffering from COVID-19, want you to know you're in our thoughts and prayers. And our hearts and prayers go out to the families who lost loved ones during this COVID pandemic crisis. Our latest complete test data for the week ending December 6th, we had an average of 5,552 people tested each day. That's nearly, it's up about 38% from the previous week. Testing activity increased since Thanksgiving, and we'll continue, we're going to continue working on expanding testing here in Boston. This week, mobile units are available at several locations in Jamaica Plain at the Mildred Haley Apartments on Heath Street from today through Thursday. In Roxbury at the Washington Park Mall on Warren Street from Tuesday through Saturday, at our new high-capacity site in Hyde Park at the Boston Renaissance Charter School on Hyde Park Avenue, and also through tomorrow through Sunday. I want to thank the Boston Renaissance Charter School for allowing us the opportunity to use their facility. I believe this is a drive-through location as well, so thank you for that. We're asking people to call ahead before you visit any of these sites. For information on hours, or for our 30 testing sites all over the city of Boston, you can go to boston.gov/coronavirus or call 311 and we can help you with getting a test. For the week ending December 6th, the average number of positive tests each day in Boston for residents was 438 people. That number spiked, obviously, after Thanksgiving, and we've stayed at that elevated level for most of December so far, so we're pretty much into our 3rd week now of high numbers. Our community positivity rate for the week ending December 6th was 7.2%, and that's up from 5.2% the week before. Dorchester, East Boston, Hyde Park remain the neighborhoods with the highest positivity, between 10 and 12%. Roxbury, Rosendale, and South Boston are all over 8%. And we also saw an increased positivity rate in every single neighborhood in our city. So last week was one of those weeks that every neighborhood went up to some percentage degree. So wherever you live or work in Boston, the COVID virus certainly has been spreading. In addition to the elevated case data, activity in Boston hospitals continues to increase. We are in contact with our hospitals on a daily basis, and on each of our key metrics we track, the data is moving closer to our threshold for concern. Those include daily emergency room visits for COVID-19, the ability of adult medicine and surgical beds, the availability of adult medical and surgical beds, the total occupancy in our intensive care units, and we're also seeing increase in activity in our Boston EMS calls, our 911 calls. I speak to our hospital leaders frequently. They certainly have surge plans ready, and will be able to expand the capacity and treat everyone who needs it. They are not in danger at the moment of being overwhelmed, our hospitals, but they are seeing confirmed the continued spread of the virus, and shows more people are getting sick, and that's what one of their concerns. I was talking over the weekend to a hospital president, and what he was concerned about was we're seeing more and more people get sick and more people having to go to the hospital. If these trends don't stop, it will be a very difficult winter for our hospitals and for a lot of people. So our public health experts have been analyzing this data closely and developing a plan. And rather than wait until the situation gets worse, we're going to be proactive here in the city of Boston and other towns here in Massachusetts. We're going to take action now to reduce in-person activity in our city. We're working to slow the spread of the virus in our city and prevent our hospitals from getting overwhelmed. So today, this afternoon, the Boston Public Health Commission issued a supplemental order adjusting COVID-19 restrictions in the city of Boston. Starting this Wednesday, December 16th, Boston will be moving back into a modified Phase 2, Step 2 of the reopening for at least 3 weeks. Our goal with this 3-week pause is to slow the spread now so we can avoid more severe shutdowns later on. Our focus as planning this action has been to prioritize essential activities like getting more high-needs students and children back into our schools, as we are doing today, and I'm going to talk about in a couple minutes. In addition, we've been in close contact with the communities all across Greater Boston. We're going to take a regional approach for maximizing effectiveness. Several cities and towns are taking steps this week with modifications fit to their particular needs. They include the City of Newton, Somerville, Brockton, Town of Winthrop, Town of Arlington, City of Lynn, and other cities and towns that will be announcing over the course of the next couple of days actions that each of them are taking. Before I mention some of the activities affected in Boston, I want to be clear. This is not about targeting specific sectors that cause the virus. This is an effort to reduce overall activity outside the home using mechanisms afforded by the state's reopening plan. In fact, we want to minimize the negative impacts on working people and small businesses. After 3 weeks, we will then reevaluate the situation to see where we are with the virus here in the city of Boston. If these metrics have moved in the right direction, and we hope they will, we will lift these restrictions. Some of the changes include museum, movie theaters, aquariums, and indoor event spaces will temporarily be closed to in-person use. Fitness centers, health clubs, gyms closed for general use. One-on-one personal training can continue with space restrictions. Outdoor gym activity can operate with fewer than 25 people following the Phase 2 guidelines. Indoor recreational and athletic facilities will be closed for general use, consistent with Phase 2. Structured youth programs at community centers may continue. Indoor facilities for lower contact activities will also temporarily be closed, including bowling alleys, batting cages, driving ranges, and rock climbing. I want to just say to all the businesses, I want to thank you for your support and the cultural institutions for your cooperation and support during these very difficult times. The vast majority of people have worked very hard in full compliance at every single stage, and you will have our full support in the reopening and the recovery efforts. Activities that continue as part of Phase 2 include, this continues, retail stores, personal services like hair salons, barbershops can remain open, outdoor theater and performance venues at a 25-person limit. Office space will remain at limited 25% capacity, but I want to urge all employers to make sure that anyone who can work from home is working from home. In addition, indoor dining at restaurants and bars may continue with strict adherence to guidelines. That includes 6-foot spacing, 6 people per table, 90 minutes time limits, and 9:30 closing times. One change during this pause is bar seating will not be allowed except with special approval granted by the Boston Licensing Board. That's to ensure materials are in place to protect both staff and customers. I know that many people have concerns about indoor dining. These are concerns about the possibility of viral transmission. There are concerns about the ability of restaurants to survive closure during these restrictions. I hear both of the concerns, and we're responding to both of the concerns. Our approach is to follow the Phase 2 guidance with additional restriction. We are restricting bar seating to special approvals, as I mentioned, and we are increasing enforcement of all guidelines for all licensed businesses. We will have emergency license board meetings every Monday to address any violations from the previous week. But I also want to appeal to restaurant patrons and small business customers to be part of the solution. We hear from owners that it can be difficult to please customers who keep their masks off or ignore distancing guidelines. So I ask you, if you dine in a restaurant or you visit a store and you want to help small businesses stay open, do your part and follow the guidelines. And whatever possible, use takeout and delivery services to give our businesses business, but also allowing people to have safe experiences. You can find out more detail about how the order affects each sector if you go to boston.gov/reopening. Tomorrow morning, we'll be hosting a series of webinars for small businesses to go over the changes. They start at 9 a.m. with a general overview, followed by special sessions for restaurants, gyms, and performance spaces. You can also join our weekly small business conference calls beginning tomorrow at 3 p.m. To get all information on all of this, you can go to boston.gov/smallbusiness or look it up on the Mayor's Office of Economic Development Facebook. And please reach out if you have any questions or concerns about anything that I'm saying. The Reopening Boston Fund is still accepting applications to help small businesses with debt-free grant loans. And I don't want anyone to think that we're taking these decisions lightly. We are making sure we're basing everything on a public health situation. And we're looking for the economic impacts and restrictions which are real, and they're human impacts as well. We weigh everything in the balance. I don't ever take lightly the impacts of workers, business owners, nonprofit organizations that are certainly affected by our actions today. But public health needs are clear at this moment. We must take action to slow the spread and protect our healthcare system, and we must prioritize the absolutely essential needs of our city. Getting our young people back into our schools is one of those essential needs. A month ago, on November 16th, we opened 4 schools for 200 high-needs students in the city of Boston. And today, 28 Boston Public Schools are reopening with in-person learning for roughly 1,700 of our highest-needs students. These young people who face risks in their well-being when they're not in school need to get back into the classroom. They are students whose families have opted in to in-person learning. We have been doing everything we can to get them back into the classroom. And that's part of what today's actions are all about. When we reduce non-essential activity so we can prioritize education here in Boston. I want to be clear, the Boston Public School Department has the support of my entire administration and has prepared these schools, these 28 schools, for COVID safety. And I want to be very clear on the safety precautions that were put in place. Air purifiers in every occupied space and frequent air quality testing happening in our schools. The best possible filters in all HVAC systems. Medical grade PPE for staff. Disposable masks for students and staff. This week we're also launching a new COVID testing pilot for teachers, students, and staff. This level of protection goes far beyond CDC guidelines, beyond state guidelines, and beyond what the vast majority of districts all across this country are doing right now. I give tremendous credit to Superintendent Brenda Casilius and her team for doing incredible work prioritizing our students who most need our supports. These are challenging times. These are not normal times. When the superintendent came to our city a little over a year ago, the last thing that was on her mind was shutting the district down and dealing with a pandemic. And that's what she's been dealing with for the last 9 months. So I want to address the vote that the teachers union took yesterday criticizing the district and the superintendent. That action doesn't help our collective efforts during this critical time. I value deeply the work that our teachers are doing and have done all year under very difficult circumstances. I am sympathetic to their concerns about COVID safety. They are all of our concerns, and we are responding to all of those concerns. 100% of the safety measures that the teachers union requested are implemented in all of our schools that we reopened. I want to repeat that. 100% of all the safety measures that the teachers union requested are implemented in the schools that we opened today. The result is that today, many more high-needs students and their dedicated teachers and support staffs are in schools. They're working together, being safe, and they're learning. That's a great accomplishment by all involved. We're going to continue to support our teachers and our school staff in this work. And we're going to keep our promise to the families of our children that we will do everything we can to get their kids safely back into school where they belong. I have the absolute confidence in Superintendent Brenda Casilius and her team's commitment to these values and all of this work. In hard times, we certainly need to come together. But one key piece missing from the puzzle right now is federal support. A national relief and stimulus package is long overdue. The actions we take today would be much more straightforward with federal backing for the workers and businesses that are impacted and affected by it. The Biden-Harris administration plans to act immediately to bring comprehensive supports. But the American people can't wait until the inauguration on January 20th, 2021. The emergency unemployment benefit is set to expire on the last day of this year. The CDC moratorium on evictions is set to expire on that same day. There's a little over 2 weeks from now, and it could be the worst part of the pandemic that we've seen that we're going through right now. This is going to deepen the crisis conditions in every American community, including the city of Boston. Since the beginning of this pandemic, I have advocated to the federal government to do the right thing and help individuals, small businesses, cities and states, and all Americans all across this country. I have sent letters and made phone calls on every essential issue, from food benefits to child care, to small business relief, to immigration protection, low-income housing and homeless supports, arts and cultural organizations. But it shouldn't take mayors and governors begging the federal government for help. Congress and the sitting administration needs to do their job. The American people need help right now. Small businesses need help. Our restaurants need help. Nonprofit organizations need help. Cities and states need help. Much of our essential work that we do depends on federal funding. I know that there are differences in what parties want to prioritize, but something has to get done. It's time to put the partisanship away, and we need to continue to press forward so we can move our country forward. In the meantime, we need everyone to stay focused right now and stay vigilant. We're asking people, this has to be a collective effort. We need everyone to do their part. We cannot let our guard down, not even for a little bit. We need to keep wearing masks. We need to keep washing our hands with soap and warm water. We need to avoid large crowds. We need to avoid gatherings. We need to avoid parties. When you go out, only go out for essential items. Please follow the guidelines while you're visiting businesses. And I ask everyone to make decisions today based on safety and commitment for safety over the holiday. We are living with what happens right now, what happened over the Thanksgiving season right now. We can't let that happen again. If you look at the trend, a couple of days before Thanksgiving, we were averaging about 125 cases of coronavirus per day in the city of Boston. 5 days after Thanksgiving, we were at over 500 cases per day, and those numbers have not come down. I'm asking people not to be traveling for Christmas. I'm asking people not to be hosting holiday parties of any kind. You should be limiting your gatherings in your household to only your immediate family. Today's rollback is about making individual sacrifices for the greater good. And it's about how we approach and how we're going to approach the holiday as well. The holiday is a time for collective renewal during the dark winter months. That's what we'll focus on this year more than ever before, only in different ways. I do want to end the press conference on a positive note because it seems like I'm all doom and gloom today. This morning, the first shipment of vaccines began arriving at our Boston hospitals. If you've been watching TV, you've been seeing it. You've been seeing people get their shots. And this week, each of our hospitals is going to begin vaccinating healthcare workers in our city. That is the light at the end of the tunnel, and it's the beginning to grow brighter that we've been going through for the last 9 months. So as we buckle down for some more weeks of hard work ahead of us and vigilance, we can take some hope knowing that better days are in sight. I ask everyone to follow the lead of our healthcare heroes and medical experts and take the vaccine when it comes here. It's another act that we can all take as individuals to protect ourselves and our families and bring our communities safely through this crisis. I also want to give a special shout out to our hospital workers who right now are exhausted because we're seeing increased numbers of COVID activity in the hospitals. Not only are they taking care of the COVID patients, they're also taking care of their other patients, and they also have families. So I'm asking each and every person to physically distance, wear your mask on behalf of all of our healthcare personnel right now who are in the hospitals, the doctors, the nurses, and all the staff in the hospitals that are working for us. With that,
enforcement for the what's enforcement going to look like? Are there going to be fines, violations? And second question, why keep indoor dining but shut down places like gyms?
thank you. The first part of your question is enforcement is going to be, inspectional services will be going out and doing checks on restaurants. Believe it or not, we do get calls from patrons that will tell us that some place might be overcrowded or people are walking in without masks. So we are going to be going out there writing up violations, and that's why we're going to have a hearing every single Monday morning to address those violations. The intention is not to collect fines. The intention is not to be hard on businesses. The intention is to keep people safe and healthy, and that's what we want to do during this period of time. Our focus on reducing overall in-person activity, as we're doing right now, we are not targeting specific industries here in the city of Boston for being the cause of the spread. We are returning to phase 2, step 2, so we're going back one phase. In that phase, indoor dining was allowed and is allowed in that phase, but we are adding a ban to seating without special permission. So we're going to be monitoring all of the situations really closely as we move forward here.
Will restaurants be shut down if they keep having violations?
It's not necessarily the violations. The restaurants aren't necessarily having mass violations in the city, but restaurants will eventually be shut down if our numbers continue to go up, if we continue to have problems in our hospitals, and once we get to a point where we're over capacity, we're not going to wait till we're over capacity. When we get to a point where it's going to be dangerous and critical for capacity, we will have to take the next step.
What about other sectors? Retail, obviously, we're in the run-up to Christmas.
Yep.
Retail, youth sports leagues, film production, are any of those sectors going to be affected by this?
No, film production won't be. I believe we have one film in Boston, and they presented us with a public health guideline protocol, so they have a really stringent plan in place. So a lot of these different there's a few places exempt. We'll get you a copy of it all. We'll look at the protocol that's in place. If we think that the protocol is strong enough and it's limited enough, we'll be able to keep some of those sectors open.
Retail and offices, not affected?
Retail offices 40%. Retail's not impacted yet. That's in phase 2, step 2.
And youth sports leagues affected at all?
No, youth sports leagues are fine.
Mayor, what do you see over the next 3 weeks with these rollbacks? Just overall numbers?
Yeah, the biggest thing that we want to see with these rollbacks is that our numbers come down and that our hospitalization comes down and that we get to an average rate. Right now, as I said, the last 7 days, 434 people have been testing positive for COVID-19. The rate is over 10% or something like that, 7.2%. Our goal is to bring these numbers down so that we don't have a stress in our hospital system. And then also, on top of that, as January approaches, our goal for Boston Public Schools is sometime in January begin the phased-in reopening plan. We're going to go back with the highest need students first, and then we're going to go K0, K1, K2, 1 to 3, 4 to 8, and high school. And we'll be launching, hopefully dates around that at some point, but right now it doesn't make sense because the numbers are going in the wrong direction.
Are these rollbacks now because of Thanksgiving, a direct result of what happened over
I'd say that's one part of it, definitely one part of it as a result of Thanksgiving and the increase in Thanksgiving. And I mean, I don't think Thanksgiving is the only reason why the numbers are getting higher, but it seems like it's the main reason. Standing here a week from now, we'll know if the numbers have gone down a bit, then it wasn't just Thanksgiving. If the numbers stay consistent, it's going to be Thanksgiving/holiday season that we're seeing these numbers increase.
One more question. Councilor Andrew Campbell today is calling for weekly testing at schools for students and staff. Is that part of the overall plan?
Yeah, we're working towards that. We don't have students. We only have 200 students in schools right now. So what we're working on right now is a plan. How do we test it? There's no district in the country doing that because of the availability of tests. So we're working to try and build up the capacity.
What were the metrics that were surpassed that you said, okay, we need to do this now?
I'll ask Marty Martinez to come up and talk a little bit about the hospital metrics.
Thanks. So the question was, what were the metrics that passed that put us to this place? We've been focused on these hospital metrics, emergency room department visits, the capacity of our ICU beds, as well as the overall number of beds available, not medical and surgical beds. And we have thresholds, and we haven't hit those thresholds yet, but you're likely to see by the next time we're up here, we're going to have hit 2 of those thresholds. And so we're seeing our overall medical beds be reduced, and we've seen right now we have over 300 COVID positive patients in the Boston hospitals. We haven't been at that number since June. So we've seen more patients, we've started to see less beds, which definitely means our capacity in our hospitals is starting to be something we're concerned about, which is why we're leading into this next phase.
How concerned are you about that? And if in fact that happens, how likely is it that this is actually extended perhaps into the end?
Yeah, the question is, how concerned am I about seeing a surge from the holidays and potential extension of what we're doing here, even going back further? I'm very concerned about that. I'm really concerned about the holiday travel. I'm really concerned about holiday parties. I'm concerned about house parties. I'm concerned about seeing these numbers go up every day. the public health experts, Dr. Fauci and the CDCs, and even our own public health folks around here said that we would see increases potentially in November, December, January, February could be the worst months of the entire pandemic. Everything they've said has come to fruition. We've seen increases in November and December. Our numbers in December are pretty high, and January, February is not here yet. And in coming off the heels of Christmas and the holiday season, we could see really bad numbers. And what that means when you see really bad numbers is more death, more hospitalization, more ventilators, straining on our hospital systems that would hurt everyone else that might be going in for cancer screenings or heart procedures and things like that, because that gets pushed aside. That'll get put off because of the concern of people going into hospital. So I'm alarming people right now. I'm sounding the alarm, letting people know the seriousness of this. This is serious. When you see, New York, the state of New York shutting down indoor dining, they're a little ahead of us as far as hospital capacity, meaning more people in hospitals. I had a conversation with the mayor of Philadelphia, Jim Kenney, the other night, and we were talking about his decision to shut restaurants down in Philly. They're ahead of us as well as far as hospitalization. This is real concerning. This is real concerning for us, and our economy, and when I say our economy, our businesses have taken such a dramatic hit this year that one more blow like what happened in March, April, and May, where we had to shut everything down, could put many more out of business. It's my understanding, talking to the Restaurant Association last week, 3,400 restaurants in Massachusetts have gone out of business. They need help. They need help on a state level. There's a piece of legislation right now in the economic development bill at the state. I'm asking the legislatures to get that bill done. We're also talking about a potential piece of legislation that's going to benefit restaurants as well. By looking at that, we're going to be talking about that piece of legislation. And then also the federal government has to act. This is not a time for inaction. This is a time for action.
Mayor, you've been pretty consistent over the last 9 months in terms of the rollback, saying that, as Boston reopened, in terms of the reopening, as Boston reopened, you didn't want to have to roll back.
Yeah.
Obviously, you're doing that now.
Yeah.
Are you frustrated? Are you disappointed?
It's hard to say frustration or disappointed. It's a virus, and it's a pandemic. I think that obviously we'd love to be in a different place, but you can't get frustrated or aggravated with a pandemic. What you have to do is learn to live with it, and we have to be able to make arrangements around it. And I just think that when I hear stories of people visiting loved ones and maybe passing on the virus, and they're visiting somebody, we have to be careful. But when I hear people having house parties and total disregard of masks and that's a little frustrating, because that I know people want to congregate, and I do too. Though Christmas is coming. Christmas Eve is one big day for us in our house, and we generally bounce around from house to house, and families all together. And Christmas Day, the bunch of us together again, and not this year. You can't do it this year because of the potential impacts of bringing COVID into your home, and you don't know what the impacts of COVID is going to be on people, particularly people with pre-existing condition or older people. This virus is deadly to them, and you don't want to do that to your family.
I know you addressed this in your comments, but just to put a fine point on it, do you still have confidence in Superintendent Vasilius' ability to lead the district in light of the union's no confidence?
Absolutely. I think that no confidence vote came with 6 days left of school. And, I was reading, I think you did the story actually the other day, where some of the union was quoted as saying, we're excited about getting high needs, special needs students into school. And that's what we're doing today. And then there was a vote of no confidence yesterday, which I don't understand. So I think that, we're living in a pandemic. The people that are listening to me talk about that vote of no confidence, those people that vote no confidence, you have to realize and understand that we're all living through a pandemic, and taking action like that is very short-sighted. Thanks, everybody.